clinical service lines. This is a topic that's really becoming more and more important with hospitals. I'm seeing a lot of hospitals doing oncology, cardiovascular, and different specialty focused clinical service lines. They're driven by physicians. So this is really an opportunity for physicians to identify within the hospital, but also within our practice, what are some clinical service lines that we can develop and we can drive. The goal is to improve the clinical quality of care, the operational efficiency. So some of the things that I've been talking about, by grouping those like patients together into a clinical service line, we can now start bundling resources together, whether it's care coordinators, patient registries, flow sheets, all the things that ideally we would like to utilize to get the best outcome for the patient. Physician leadership opportunities to develop centers of excellence and manage the clinical service lines. Maybe you have some specialty, subspecialty training, or you have a particular interest in a particular disease and you've done some additional work or some additional training. Those are the things you'd like to be able to utilize, and how can that help differentiate you, help differentiate your practice, as well as the network in the market. Population management, we've talked about that, but it really comes down to the triad, the analytics. So we've got to have good data management and be able to report that data, understand it, care improvement processes, and then third, the patient engagement strategies. So I think we've talked about each of these key components, but one of the key drivers is, that outpatient care. How can we make sure that the post-acute care and the post-hospital discharge patient care is really optimized so that we prevent the bounce backs, we make sure that the patient has clear follow-up instructions, they have a care plan, and then all the points in the continuum of care are acting in good coordination to achieve the best outcome. Managing the patient population, some of the other things, proactive care management. I think we really talked about these things, the predictive modeling. But the more that you start thinking about it from a proactive standpoint, how can we identify opportunities to use a clinical service line mentality to group resources together, to group protocols together, to group systems, people, and so forth together to create the best outcome at the lowest cost. That's our goal. Wellness and preventive care. Again, I think we've talked about most of these, but that transparency and accountability really becomes important. Making sure that patients see that so that they can really follow up on their care. They know what's expected of them is important, as well as other providers in the continuum of care. Providing new services, a lot of it really depends on your specialty, on your practice, the demographics, in this area, and so forth. But it starts with what are some opportunities that we could, meet some needs, meet the hospital needs, meet employer needs, meet patient needs, certain chronic conditions and so forth, and then leverage those opportunities.